suture is the vertical mattress suture. So first bite will be taken again from the buccal aspect, keeping a little extra distance from the incision line. The same will be continued on the palatal aspect, again keeping a little extra distance from the incision line. So the bites are kept little farther off. The next bite will be taken from the palatal aspect, closer to the incision line, right in front of our previous bite. And the last bite will be taken again on the buccal aspect, right in front of the first bite, very close to the incision line. And tying the knot in similar fashion, 2 throws clockwise, 1 anti-clockwise, 1 anti-clockwise, 2 throws clockwise, 1 anti-clockwise and 1 more clockwise. And we will cut the remaining suture. So this suture is called as vertical mattress suture. Thank you everyone. Hope this video makes your basics about suturing very clear. Thank you everyone.